pochino come alzi, rilassata, fammi alzare a me. No, questo sale. Potresti avere un po' di tensione qua?
Sì, non...
Qua di meno.
Sì.
Sull'esterno?
Ah, il solletico.
E qua?
Qua di più.
Esatto,
Ok.
quindi clavicola un po'
Sì.
qua. Qua di meno?
Meno. Mhm.
Ok. Sì, è alternato. Ok, mani su da me. Qui, allora, metto indice a contatto con l'altro indice. Senti che c'è una differenza? Destro
Sì.
è lungo?
Sì.
Gira la testa a destra. Migliora ma non del tutto. Gira a sinistra. No, qui rimane proprio, sarà questa la diagonale tua. Dritta col ginocchio e col gomito, spingi in su tutti e due. Ok. Dritta col ginocchio e col gomito, spingi in su. Perfetto, vediamo se c'è un problema. Fa male qua?
Meno.
Testa dritta?
Sì.
Un po' di più.
Sono storta. Ah.
Gira la testa a destra.
Mhm.
Meglio, eh?
Sì.
Vediamo come rispondono gli psoas. Spingi in su. No, non è bloccato, per fortuna. Spingi in su. No, va bene. Posso continuare a fare quello che avevo iniziato. Quindi sinistra in alto, rilassata. Morbida, morbida, morbida. Ok.
Bellissimo.
Allora,
Mhm.
porta il piede in su, spingilo esternamente contro la mia mano, vai. Peroniere, va bene. Vediamo quello lungo. Spingi in esterno.
Faccio?
È la stessa cosa, spingi esternamente, vai. Vai. Vediamo il confronto con questo, vai.
Quella è quella sana.
Sì, è un pochino di differenza c'è.
Sì.
Questo però
Però è stata curata bene in realtà.
Sì,
Con tutti i macchinari,
ma non
sì.
è un problema del muscolo, è un
No,
problema del perone.
tendine. Ah, ok.
Guarda. Spingi fuori. Ok. Vai. 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 Qui un po' di meno. Vai. Qui sei fortissima. Vai. Qui un po' di meno. Poco, non è tanto però.
Ok.
Rilassa. Ok. Buono?
Mhm.
Qui va bene. Mano qua.
Ok.
Rilassata. Lascia, lascia, lascia. Ole.
Wow.
Sentiamo. Che adesso devi fare Pilates. Reformer?
No, stasera palestra normale, faccio tipo CrossFit, un po' più leggero.
Senza pesi.
Con i pesi.
Con i pesi. E allora leggero come?
Che non è CrossFit proprio circuito dove giro a spostare i pesi. Cioè.
Dove te la vedi?
Monti di Burtini.
Hai fastidio qua?
No.
Qua?
No.
Qua?
Un po'.
Qua?
No.
No, è questo quello che ti dà noia. Un bel respiro? Fuori? Scusami, ok. Abbasso poco poco.
Certo.
Ok. Ok. Sdraiata sul fianco destro. 1, 2, 3. Avanti. L'importante non è quanto, ma è dove e in che modo. Nel senso,
Ma io faccio una cosa molto sbagliata, penso.
lo fai da sola.
No, sì, ma mi chiudo. Cioè, siccome sto sempre con la schiena arcata, basta che io chiudo la schiena così
E scrocchi da
subito,
solo.
lo faccio sempre.
A noi però interessa che scrocchi qua,
Ok.
perché questo è quello che ti toglie la tensione
Ok.
qua, capito? Quindi io vengo a prendere un contatto preciso e ecco. Adesso, morbida. ok? È molto importante contatto e direzione, perché io posso insegnare una scimmia come si scrocchia una schiena, però come si corregge una disfunzione è un altro paio di maniche. Torna a pancia in giù un attimo, vediamo se hai ripreso la forza. Spingi in su. Sì, non c'è il minimo dubbio. Hai fastidio qua?
Ma un pochino.
Ok, e hai fastidio qua?
No.
Ok, quando rimane un po' di quel fastidio là, la facciamo vedere. Stendi il braccio, spingi in su, forte, spalanca la bocca, spingi in su, spingi in su, stringi i denti, spingi in su. C'è una piccola differenza, ma ecco, qui è quando noi diciamo che il test muscolare deve essere un'arte, non una scienza, perché devi avere la percezione di quello che sta succedendo. Fastidioso.
Ok.
Vai. Il muscolo è qua. Chiudi vedi che non c'è spazio? Ok, spalanca tutto, eccolo qua. Perché questo muscolo qua genera tensione e manda in disfunzione l'altra vertebra. Scusami, Damiana. Apri, apri, apri. Apri tutto. 3, 2, 1, olè. Ti chiedo scusa.
Ok.
Vediamo, ci riproviamo per la terza volta. Faccio canestro o no?
No.
Ok, mani così, bravissima. Il tuo gomito, spingilo rapidamente indietro. Guarda, guarda me, così. Tac, un colpo secco. Ok, ti do io il via. Vai. Olè. Vai. Doppio.
Bellissimo.
Cammina un po', mi dici come ti senti?
Bene.
Meglio di prima? Peggio di prima, uguale a prima?
No, no, no. Bene. Cioè, tipo più leggera.
Ottimo. Lo consiglieresti?
Sì, assolutamente.
Bene, magnifico. Domande, dubbi, curiosità?
Mi controlli questo braccio?
Che cos'ha questo braccio?
Tendinite? Epicondilite? No, a me fa male qua.
Ah, epitrocleite, ok. Perché più condilite è di qua, stavo andando a controllare.
Ok. Malissimo là.
Da qua, spingi il braccio in giù. Male.
Tira qua. Ah,
Eh,
lo vuoi sapere perché?
eh,
Il telefono. Che sto così.
tanto tempo, tutto il
Tutto il
giorno.
giorno, 12 ore al giorno, così. E quindi mi tira qui e mi fa malissimo qui.
Mi ci vorrà un po', questa tecnica si chiama nerve flossing. Non è piacevolissimo. Mi fermo? Vabbè, dimmi tu.
No, vai.
Aspetta.
Ah.
Qua anche? Tutto. Qui ci vorrà qualche seduta,
Ok.
Ti faccio tornare.
Però non posso smettere di usare il telefono.
Ci lavori, mi hai detto, no?
Sì.
No, proprio in virtù del fatto che non puoi smettere, dovrò vederti un po' più spesso.
Ma c'è qualcosa che posso fare da sola? Cioè,
Sì.
perché mi dà sollievo massaggiarlo.
Sì, allora, così e pieghi la testa di qua col gomito sempre dritto e poi di là e fai questo.
Ah,
Poi torni qua
questo ok, l'altro no.
e poi... lo so, perché ti sto accorciando e allungando il
Sì.
nervo, ok? Non il nervo, ma diciamo sto mettendo e togliendo tensione.
Tira tutto.
Ok, ma tu scusami, fastidio?
No,
Qua?
no, no, no.
Quindi nel cavo ascellare non c'è compressione.
Non è proprio la posizione del telefono.
Va
Per
bene?
questo dico mi fa male pure il pollice.
No, gomito. No, non
Non
è
è il
articolare, è
gomito,
proprio
è-
muscolo e nervo, sì.
È perché questa è la posizione. Usando questo dito faccio questo tutto il giorno e sta tutto in tensione sempre.
Il polso qua l'abbiamo sistemato. No, a livello no, è muscolare, ci devo lavorare un pochino.
Ok, quindi si può sciogliere, però il
Sì,
problema
sì, sì.
c'è.
Il problema c'è, il problema c'è.
Qui
Sì,
no.
We saw her before previously for some shoulder tightness and shoulder tension, but something new came up and I figured it would be worth showing. So what'd you do? What happened?
I was stretching and I heard this pop and crack in my like hamstring area, and my the pull, the tension just went loose and I fell over and I was like, what's this thing?
So this just happened today, yes?
Yeah, and then I called him and I was like, hey, I think I broke my leg.
So let's have you point to even where you felt it. So
It was
while
like
doing
right
yoga
here.
and right on the back of the hamstring, but you felt a pop.
Yeah.
So what I told her previously was that when we hear a pop, it's usually not actually a muscle, it's coming from the joint somewhere. So that muscle, the hamstring, attaches up at the hip bone and down at the knee. So I'm thinking it was one of those two things, but we're gonna do an assessment so we can figure out what's going on with that, where it's coming from. But we're gonna start actually with just some light motion first, because I wanna see how you're moving now after that. Just reach forward first. So pain with that on the hamstring.
A little bit, but not
Okay.
much.
Okay, and then how about just leaning backwards? So we're looking.
Yeah, right here, but it's not, it's really deep in there, you know?
Okay, so right here for your nerds out there, what we're doing is we're moving through the pelvis. Seeing how the pelvis moves when she leaned forward is actually where we see most of that abnormal movement come in. But let's see a side bend to each side now. So sliding your hand down your leg, good, and then to the other side. Does that agitate it to either
No.
side there? Okay, good. Let's have you lie on your back, please. So face up. So before we look at her spine, we're doing things different today because of what she's specifically done to the leg. And I just want to feel that normal motion first of that knee, and then also some of the motion of the hip as well, internal and external rotation of that femur, we call it. I'm thinking just from kind of seeing her move a little bit, to me it's looking like it's coming from more of this. And I'm actually going to palpate here the trochanter. Yeah.
Yeah.
Any tenderness
I
right
feel that.
there. Yeah, me too. So, and more so right in the middle, right there. So more than on the front,
Yeah.
and more than on the back end of that, right there.
Yeah.
So I'm palpating the greater trochanter for anyone that's nerdy out there watching this. So now we're gonna,
Yes.
so internal and external, and that even more so
Yeah.
is not moving. So feeling for internal and external rotation of the hip, that's where it really gets stuck, or that's where it
Yeah.
really doesn't want to move. So just from that, in my mind, I'm definitely thinking more so it's coming from that hip, and then we're gonna feel that front to back glide of the knee. That feels fine, and then a side to side too. So anytime we hear something, if it is a pop, I'm just checking worst case scenario, structure of her knee for that structural integrity, making sure you didn't pop any kind of ligament or have any kind of tear in the knee. You have not.
Yeah.
Yeah, and this should not feel painful at all to you. Definitely from feeling motion and just from doing a couple slight things, it is that hip. So that pop, even though you didn't feel like it was coming from your hip,
Yeah.
it was. So let's have you go face down, please. So turn over, and we're gonna do some analysis more with the pelvis on the SI joints, so the sacroiliac joints. So looking at the leg length, we're way off there, Natasha.
It's really bad.
Your right leg is significantly shorter than the left. With the way
Wasn't it
this.
the other way around?
Yeah.
What's happening?
So probably just something that she did to her pelvis when she was doing yoga, and yeah, that
I feel that.
immediately, me too. And on that, so more on the right side,
Oh.
yeah.
Yeah.
And that right one was the one that was way short. And even though on the front end it was the left hip, you feel how sore it is back here on the right. So the problem is not always even where we perceive we feel something. It can be something connected or something close. And then I want to muscle test the hamstrings also.
Okay.
The hamstrings neurologically are controlled through here, the lower lumbar. So from talking to our nerds out there watching the video, So let's test again the one that you didn't feel anything to. So that, and I want you to kick toward your head like that, okay? Go ahead. Okay, and I'm giving good resistance there, and you've got good strength. Natasha, you feel how that feels good? Now one more time with this, push toward your head. And not as good. It's not horrible though. That's not even really that worst one. We're gonna do a couple more, because I'm thinking more so just that pelvis is where we really need to address. So I would expect with feeling your pelvis and seeing the leg length here that her glute muscles are really disengaged more than anything. So let's have you hold this out here. I'm gonna push in, don't let me, and nothing there. So exactly what we're feeling is. And you feel, Natasha, how that feel weak to you?
Yes, super weak.
Okay, and we'll check the other side for reference. Hold there. So much better. I can't move it. Now let's check the other glute, the glute max, the big mover here. I'm gonna push the leg down, don't let me. Okay, not horrible. Let's check this one. Same thing, hold here, don't let me push it down. I said don't. I know. Feel it's harder, right?
Yeah.
So we're gonna make an adjustment to that right hip first there. So let's have you on your side with that right side up, and then I'm gonna bend the top leg. There you go. You know the drill. And I'm gonna roll your whole body toward me, soften there, soften. Good. And then let's have you go face down one more time. We're gonna retest a couple things and we're gonna see if that feels different to you also. So first thing that we looked at, and even how she laid on the table was different. It's straighter, which is good. And then the leg length there, we're back to even. That was a huge change. Yeah, and that's not poking out so much, and that probably feels different. How does it feel compared to where it did?
Less tender and there's no pain.
Good, that's what we want. So then as we retest these muscles here, where the nerves from the pelvis control, we should see better activation. So on that right side was where we were finding the weak ones. So hold here, Natasha. I'm gonna push in, don't let me. Hold. Okay, there. One more time, hold. There, good. That's what we want. Kind of bring this up. I'm gonna push down, don't let me. Good. And then let's check the hamstring on this opposite side even. So kick toward your head. Hey, I like it. Better. So seeing those muscles turn back on, that's good. So before we even do anything else there, I want to have you stand, and I want you to just, we're going to run through that motion again and see if that feels different even. So now, again, just reaching forward.
Yeah. I feel like pain here though.
So on the hamstring still.
Yeah, but that's probably a muscle, right?
Yeah, so muscle attaches to bone, and we went to that origin of where the hamstring starts. So we're still going to evaluate, but one more time with the extension also. So it back, so you move better.
Yeah.
Through both of
Mobility,
those. Yes.
range.
So that's first thing, but now I am going to actually feel that muscle where you're feeling it. So let's have you lie face down for me one more time. So I'm going to palpate that muscle from origin to insertion, and really that center point is where I'm going to start, where she's feeling it. And where, so point one more time for me, where you're
right here, or like here, like kind of on this side of the muscle. Do you know what I mean?
Okay. So there's a couple divisions of that muscle, and I'm feeling right in that centerpiece of where she's pointing to, so I can see, and I feel some ropiness right through there. I want to feel that other one for reference. Nothing there. And that right there. And as we trace that, that's actually worse as I go up.
That's exactly like
right there. So that right there. Yeah. So this is a classic, what we call like just a sprain strain injury. So something where a sprain refers to more of the passive, so the joint being injured. And Natasha, what that means is that actually that hip bone itself where we were, that where we adjusted. But then the strain refers to the muscle. So you actually that hamstring muscle
Oh.
you did strain. And right there, as we move up to where it inserts, and it inserts right on their sit bone. So we're gonna be right up where it inserts. And it's worse as I move up. I don't know if you feel that.
Yeah.
Yeah. So that's probably the most tender point of all.
Yeah.
Right there, I'm gonna put pressure on it, and I'm gonna move toward that insertion as I shorten the muscle, and then I'm just gonna lengthen it out like that. And then as we have her move again through this after, should feel better. There we go. Okay, good. Let's have you stand for me one more time, and we're gonna do that same motion that we went through as we have you forward.
Oh, it feels like so much looser.
Good, yeah.
Yeah.
So now that's where addressing both bone and muscle comes into play. Now we've done that. We're gonna adjust the rest of your spine now.
Okay.
So let's have you go face down for me one more time, please. So feeling for motion of her spine. We've been working together for a while now, so knowing where her spots are that we've been working on, but still every time things are adapting and changing, so it's different. Right there between your shoulder blades. Big breath in for me, please. Let it all go. A little push there. There. Good. You all knotted up that was too.
Yeah.
I didn't want to move with just a little bit of pressure, so the more that second time. And good, just breathe through here. I want you to expand your ribs as you breathe, and we're just gonna let that area move. Good, it should feel easier to move. Yeah, that's what we want. And then we're gonna feel, and this is usually the hot spot for you, is right around that neck area there. Yeah, and right there.
I feel that.
Mm-hmm. Yeah. So with this, we're gonna do it a little different this time. Let's have you turn over onto your back. So with the left hand, I'll have you grab the back of your neck on that same side. Good. Now I'm actually gonna be on that side. And then with this hand, we'll keep it right here. I'm gonna put my hand right over yours.
Okay.
And we're gonna be on the upper ribs here. Big breath in for me, please. Good, let it all go. Yeah, it is stuck, so we're feeling those ribs glide. We're gonna have you do this one here, and then all the hair. Okay, I'm gonna put my hands right over yours.
Okay.
And then there, squeeze your elbows together, and I'm gonna lean you back. Look up for me. There we go. Good. So good, that's the movement we wanted. And with that, for people watching out there, I'm actually vectoring that here with my sternum, right along her spine to get that right angle. So it's not just looking for a noise, but really wanting that specific spot to move. So let's have you go face down one more time. I mean, to feel the upper back. Yeah, so much better there. So we're gonna use this. It's just a instrument that we're using to adjust her neck. With some people, I always like a cracking or a popping or a twisting. What was your experience? You were one that you prefer something else?
I like it, but I also was like, I don't know. It's kind of this. I like this though.
She likes this. So with the first thing I'm going to do is palpate the muscles along the sides of the neck. And let's have you look down for me, please. And that helps them stand out more. And on the right side, all the way up the neck, that muscle's really ropey. And I'm going to move your hair this way, and we'll show the camera right up close on the neck here. And what I'm feeling for along the neck is just these muscles along the side. And right here on the right side, you feel that, Natasha?
Yeah.
How does it feel to you? And
It feels like almost, I don't know, like a bruise. Like it's hurt. It's like tension and like a sore muscle.
There's a lot of tension there, yeah. So with you, it's been a couple different things that we've been working on in the neck, but the main one has been that top bone. It's called the atlas, and that right side there,
Yeah.
where my hand is. So at the top. And this bone I'm about to make an adjustment to so many times is a source of jaw problems, jaw tension.
Oh yeah, I have a clicking jaw. Does that have to do something?
There we go.
Like my mom told me to ask you.
Well, good thing I mentioned it.
Yes.
And you can tell your mom that you had asked me now too.
Okay,
So we'll look at the jaw too here afterward. Let's actually see the jaw open first and then close it. I can feel it click too. So your problem is your jaw is too mobile actually on that right side. So it means more homework.
Okay.
We got exercises to do to create stability. If it's too mobile, if you've seen our other videos, we don't adjust it. We stabilize it through exercise. If it's stuck and not moving, then we'll move it. But a lot of this for you is the neck. When we stabilize your neck, your jaw tension is going to minimize or go away. And there on the right side. So this is really specific on this bone. We know how it's moved, and I got to get that angle right. There we go. And what does that feel like for the people watching? when I
Feels
do that?
like a spring, just like a spring on you.
Just hitting you, right?
Yeah.
And describe the difference for me now. I'm laughing over here a little bit because I can feel the difference.
Yeah. Like
Let's let you talk.
no, there's literally like a rubber band that doesn't have tension anymore.
The tension's gone. Yes,
Feels
completely.
good.
So let's have you look down one more time, and I'm just going to refeel the muscles. And as I move my hand back and forth, there's no tight muscles at all in the neck. So again, a muscle pulls tight for a couple of reasons to try to splint or guard a joint that has a problem with it, which is going on there, and also to help try to pull the bone back into the right position. So when we do that, when we correct one of these joints, the muscles calm down. So, but sometimes, like we saw,
Feeling tight and having some pain there, especially during my workouts, and some knee tightness and a lot of swelling in that knee. So
Yes.
just kind of left-sided.
How are we doing?
Way better.
Way better. Good.
So much better, yeah. I'm able to work out now, do the workouts I wanted to do, and finish them completely without pain. I'm able to go heavier, so that's been amazing. The knee hasn't swelled up, the shoulder hasn't hurt, the hips been perfect. So
I love it.
yeah.
And then I would assume that translates even at work, maybe just a little more comfortable being on your feet with how long you are.
Yeah, I've noticed at work, after the 12, 13-hour shifts, I would come home tired, which is to be expected, but a lot of back pain, and I just related it to keeping the stress in the back and stuff, but it's really things that accumulate, so me not being aligned properly contributes to that. So it wasn't normal, but I was thinking it was. So I just feel lighter. So
How many people can relate
yeah.
to that? For sure. Cool. And then we haven't done an updated posture picture. So that's another thing we always do with all our patients. The very first day, we do a posture picture to see where we're at, and we do that again down the line, roughly a month out each time, to see how it's corrected. But without further ado, let's have you go face down, and let's check in on everything, okay?
Alrighty.
Cool. So checking in with the hips, left side versus right side. And it's the right side we've been adjusting. That's another cool thing to mention, because it's a lot of left things going on for you, right? And sometimes, absolutely, yes, it's where we feel it. But sometimes with the hip, there's really not a left or right side yet. Sure there is, but functionally, the hips are the hips. Okay, so if we change the right side, we're changing the left side. So we've been adjusting the right side, and the reason for that is because that's the side not moving so much, and the left side is moving extra, thereby causing too much motion, thereby causing pain. So we'll be adjusting her right hip today. So we'll have you lay on your left side facing me this way, please. Cool. And then just a little shuffle toward me. Good. I'm gonna bend the leg here. I'm gonna put that arm on that elbow. Cool. Good. And then back to face down, please. Good. Did Siri just say that adjustment was good?
Yeah.
Yo! Cool. So a bit of mid back here. Right there. And go ahead and let your arms kind of glide forward a bit more. Yeah, there you go. Nice breath in. And out. Let that go. And then go ahead and flip over on your back when you're ready, face up. How was that? That was a big one.
Yeah.
Man,
That
we're
was.
saving that for YouTube. I like it. Cool. And then we'll have your body kind of come over this way just a little bit. Good. Straighten you up on the table just a bit. We'll be doing a neck adjustment here though. Checking in with the neck. Cool. Checking for motion here. Alright, so one right there. Good. Let that head relax like it's laying on a pillow. Breathing in and out. Good. Okay. Checking back in here. Last one here. And this, guys, for anyone who cares, because some of you guys are paying attention to what segments we're adjusting. This is C2, the second vertebrae down in the neck. Good. First one was me, second one was her. Good. Cool, so let's go ahead and have you stand up. Or actually, we'll have you sit. I want to double check in on that shoulder. So I'll have you sit. You'll be facing off to the right, facing that way. Let me check in with the shoulder here. So when it comes to the shoulder, it's such a complex joint. There's so many things to check, not just here. The shoulder is connected by way of the collarbone. So we'll always check the collarbone. Something popping up as a shoulder might actually be a collarbone. And also, you guys know the shoulder blade is connected to the shoulder, and it's where the shoulder actually sits in the shoulder blade. Okay, so the shoulder blade's not having a easy enough time gliding across the ribs here. Sometimes by adjusting this, we'll free up the shoulder. And that's pretty much what we've been doing for Yvonne most of the time, is a lot of this rib work here, because there's some tension here too, tight muscles. So we'll have you just rotate your body to the right a bit, and then we'll grab out this guy, the activator, and we'll be running up the heads of the ribs, helping all those ribs glide around. So here we go. Good, and back to center. Doesn't feel like that's maybe doing a whole lot, but do you feel that doing something?
Yeah, it feels good towards up top.
Good, good. And then we're good there. We'll have your left hand rest on this right shoulder. I'm gonna be sitting right here. So same idea here, the ribs, we're just helping them glide around from a different angle. Those same ribs, not always everyone's favorite adjustment. So just a couple here. Good, you do good with it though. Oh, you are a little ticklish. Uh-oh, 2 more. Last one, good. Good. Stand up, move around a little bit, and then let's take that new posture picture. Cool? Cool. So we'll have you stand over here. You'll be facing that way. I'm gonna sneak by you real quick. And then we will take the picture here. So from the front, just lining that up. Not making your posture better or worse, whatever feels natural to you. Yep. Cool. And turn your whole body to the left for me, please. Perfect. So hips, knees, and ankles, guys. We're looking for a straight line from our ear, shoulder, hips, knees, and ankles. The further forward we are, that's going to cause a lot of tension on the back. And if we go forward and then come back, it's usually those points that we're feeling so much compression. So a lot of people here at the hips will feel it. For you, we're looking nice and straight. Green is ideal. Red is tracing you. Okay. So here's the cool part. It's like, hey, was that better or worse than the first time? Who knows? Well, I know because I still got it from the first time. So you came in January 5th. Today is February 11th. January 5th, February 11th. So 5 weeks. We're going to throw those into a side-by-side comparison.
Oh, that's cool.
It's cool, right? Cool. So we can see from the first, oh man, check that out. From the first time you came in, okay, all your problems were on the left. Your left shoulder was higher, and you were leaning away from the hip and knee because it wouldn't make sense to put weight into where you're hurting. So you were leaning away from the pain, as most people do. And you could see that because your head was literally on that side of center. Check that out today. Wow. Huge difference in 5 weeks. But you used to have daily headaches on the reg, and you've had none to few?
Yeah.
Huge
improvement.
5 weeks later, and we still got changes to make because hypothetically, like, walk away from this and be like, well, I'm fixed, like, I'm good. True, but if we just like never saw you again, this would be something that creeps back. So I'm still recommending to see Yvonne, but now we're at such a less frequency than what we were. Now we're transitioning towards this maintenance where she comes in every once in a while, not because she's in pain, because she's feeling good. And
We're here today with Stacy, and Stacy has got a laundry list full of stuff. So what's going on, Stacy?
Literally a whole page. I had a lot of injuries as a kid, and then growing up as an athlete, dislocated a lot of my major joints, car accident, and surgeries on my knee and foot. So not really maintaining proper care over time, and also being from a small town, not really having any proper posture monitoring, just kind of accumulated a lot of different injuries.
And we talked about in sports too, right? A lot of times it's the shake it off mentality, I think, that gets so many of us in trouble. So we did a full assessment off camera here. I'm going to show the highlights here and the adjustments as we get going. So one thing we mentioned was hypermobile or too mobile in some of the joints, right? And it's showing up on motion. So I'll have you real quick too, just so the camera can see. Looking down all the way as far as you can. Good, and then up all the way as high as you can. Yeah, so there's where we really see that hypermobility, and that nose gets all the way flat with the floor, and then same with the ear to shoulder, good to both sides, and that same thing. So seeing that, that's too mobile in my mind. So most of the time it'll be too mobile through the mid neck, but something stuck either in the upper back or at the very top of the neck, and that's exactly what we found with you through our full assessment. But motion's one of the tools, posture another that we looked at today, and then muscle tests also. So we're going to show some muscle tests down low. We'll start with the low back and work our way up. So let's have you start face down for these. And you've seen other chiropractors, and just recently too, right?
Yes, frequently. I've seen it a lot.
Yeah, and this is another common thing that we find, but it's not always maybe the right spots, or maybe it's not the specific thing for us. So many times we'll see people that have been to other doctors, other chiropractors, PTs. You've been to the PT, yes?
Yep.
Okay.
A few different ones.
Okay, so we're...
Yeah, they don't dig deep enough.
So there we go. Was this a little different than what you've had?
Yes, much more thorough
So far?
examination.
Okay, cool. So we're gonna look at the glute muscle test first. We'll start with the left side. Stacey, I'll have you hold here. I'm gonna push in, don't let me. Okay. With this one, I'm gonna push in, don't let me. So
I can't believe how difficult that is.
So that right when you feel it's not working at all, and for the people watching at home, I'm pushing the same strength on each side, but would you agree there's hardly anything in that right?
Yeah.
And this left one, I'm gonna push straight down, don't let me. Okay. And then, and not great there. We're gonna push straight down, don't let me. And nothing there. And that's, so the glute medius and glute max on the right side. Don't worry, we'll let you redeem yourself. And then feeling for motion here, we're seeing if the joint moves correctly, and if it doesn't, then over time it'll become painful. And that's right there, Stacey, with that right side. It's not moved. And I was showing her off camera here, it's the sacrum that's not moving, that's stuck, and that's what we're gonna get moving today. And then here in the mid back, right there, that one as well. And what I'm feeling for this muscle tension on the right side is really ropey even there. So that's something we want to see go away. And then at the very, very top, that's the atlas, and we found that right side of the atlas. And when we side bend the neck from side to side, when we're finding the one's not moving as much, that's where I'm really looking at. So we'll start with the adjustments here, and then we'll re-show some of these muscle tests. Let's start you on your side, facing me this way, please. And I'm gonna bend that, there we go. She knows, it's like we adjusted before. And you said last time was a couple weeks since you
Last week.
Oh, last week, okay.
Yeah.
So I'm gonna roll you toward me here. Good. And I'm gonna pin your hips down and a little push there. A little more. There we go. Good.
Got it.
And then let's have you go face down for me, please.
Oh.
I want to recheck those. Now's your chance to redeem yourself. So we're going to start with that left again. Hold out here for me, please. So good. That left stronger too. I don't know if you feel that, even though you're on that right side. So hold here. Yeah.
Oh my gosh.
And then I'm going to bend the knee. Let's bring that up. I'm going to push down. Don't let me. One more time. Hold. A lot stronger. Not perfect, but a lot stronger. Would you agree?
Yes.
Move your out of the way here.
Yeah.
So right there. Big breath in for me, please. Good, and let it all go. Good, and that's really stuck, and we've got the ribs that are involved there too, right there. Where I'm pushing, that's the rib cage. So you're gonna feel your chest pop up from underneath you, and then just very lightly, you're gonna feel this drop. You okay with that? Okay. There, that's better. And then another rib right above it. And what I'm feeling for are the ribs are getting stuck along that scapula, so that shoulder. If that shoulder is not moving or tracking correctly many times, that'll be why. Right there.
The ribs.
The ribs, yeah. Go figure. But you had a car wreck, yes? And you didn't get any treatment after, correct?
Nothing.
Okay. So they have not healed correctly, so we got some work to do. Let's have you sit up for me, please. We're gonna do this next one seated.
Okay.
So this is the top bone in the neck. This is a spring-loaded instrument. I'll show you on your leg here so you can feel what it's like. It's gonna be on your neck, on the top bone on the right side. So head down for me, please. Do you notice that? Where I'm touching?
It's really tight.
Yes, exactly. What did you just say? Mostly on the right side, yeah? So you feel the difference more than the left. Now let's have you look straight ahead. And as we make an adjustment there. Good. And then head down one more time for me, please. What do you notice?
Looser.
Yeah. Does that feel
Wait,
good
that was
too?
an adjustment?
Yes.
Oh, wow.
So we're so used to an adjustment being like a pop
Very
or
dramatic.
crack. Yeah. So you just experience that
Wow.
difference. Does it feel different when you move it too?
Mm-hmm.
So motion changes immediately, muscle tone changes immediately, the position of the bone changes immediately. That's when adjustment takes place. We're so used to seeing or hearing like a crack or a pop, but it doesn't have to be. Let's have you lie on your back for me, please. We're gonna check. So with the left knee, you had, it was an ACL and a meniscus.
ACL and meniscus twice. ACL was
Reconstruction.
fully replaced
Yes.
and meniscus was
So these are
reconstructed
major
twice.
surgeries on the left knee, fully replaced. And I want to show the highlights of a couple of the weak points here. So let's have the toes out toward me, and then I'm gonna push the leg down, don't let me. And that's, again, the patchy is how I would describe it.
Yeah.
It's like the strength is there, it's not, it's there, it's not. And we want it to be consistently able to hold, and it's not. And you had felt that, you told me before.
Yep.
Were you feeling that again still on that
Yeah.
inside part? So go ahead and relax that leg for me, please. And when I examine the full knee, I'm shortcutting it here on video, but we looked at everything structurally first. So when I pressed in all directions on your knee,
Yeah.
making sure the ligaments are still intact, they're strong, they're holding. So it's good to be adjusted, but even then, I'm not gonna hammer it. It's gonna be light, because again, an adjustment can happen, either that quick, what you've seen before, or light.
Okay.
This is a light one.
Okay.
So
I've never had my knees adjusted, so this is
here
gonna
we
be
go.
interesting.
So this is a drop piece. You've had it, I think, on your pelvis you were describing to me. It's gonna pop up and then drop down like that.
Okay.
But it's for the knee, so let's have your knee here. And then right there. Is that all right?
Yeah.
Almost feels like
Does it
nothing,
feel like
right?
anything?
Yeah, exactly. That's what we want. A little more there. Okay. And that should feel different.
It's not as tender, actually.
That's what we want. You look confused.
I didn't know that was
Like,
possible.
wait. And then toes out toward me, please. And then same thing. I'm going to push it down you feel the difference.
Oh my
there.
gosh.
Yeah. So I can feel it. You can feel it. I'll let you describe it.
I seriously thought I was just going to be in that amount of pain forever because of how many surgeries I've had on that knee.
And at the end here, we'll have you walk on it too, which is
Okay.
really cool because when you stand on it, it's going to feel completely different and more
Wow.
supported underneath you. But there's more to be done. And
Okay.
you've had multiple ankle injuries on both sides
ankles.
and a surgery on the right foot,
Yeah.
correct?
So the hypermobile joints is, I think, the reason I roll my ankles so much. But then I had this joint here, the big toe joint, kept dislocating in my sleep where I'd wake up in the middle of the night and this toe was like pointed down.
Uh-huh.
So surgeons screwed these bones together, which I think now is hurting my ankle even more. But I haven't had as many issues there, but
So what happens when anything's glued together, either by choice from surgery or from the body if it's degenerated enough, is it will become typically more painful over time. But in certain times we want to do that to try to stabilize it more, like this, to stop dislocating. But because of that, when I was feeling your foot off camera, I mentioned here that little bit of swelling, and it's not moving as well on that right foot. So absolutely, I think that from this, it totally has affected the mobility of your ankle. So first motion, what sports did you play? growing up?
volleyball, softball, track,
So,
basketball.
The volleyball and basketball were the
And gymnastics was the most injuries.
So there we go. And those three are huge for ankle rolls, little ankle sprains. A lot of times people say, well, I never had an injury because it wasn't formally diagnosed, or right, the coach would just say, shake it off, keep
Right,
playing.
right.
But it's still an injury, so they can add up. Yeah. You said it well, the accumulation of all the little things, and they add up. So here, that first one on the outside is the cuboid. I'm going to pull toward me here. There we go. And again, for not all of you, Stacy, you'll hear a noise, but we'll feel that joint move, and that's what happened a little bit here. There we go.
Wow.
And then the heel also. And that's what's really stuck, was that heel. And now I'm not going to be on that joint that was fused together. Obviously, I'm not going to try to break apart a fusion.
Oh, good, thank you.
But we're going to free up all the neighboring joints around it that are taking more pressure or more stress. And with this, I'm going to use a light force technique also. You haven't seen yet. How many tools does this guy have? This now, it's a little different than the
Okay.
one we used on your neck. It was like that,
Okay.
super light.
Pretty crazy that I never did physical therapy on my foot.
I know.
After surgery.
I know, I'd say so too. And then the middle of the foot here, this is where, you know, it's these joints almost feel fused, Stacey, because they've
They're
been
so tight.
Yeah, they've just haven't moved so long. And then a little more on the heel. There we go. And this one should move a lot different. Yeah. So on that outside there. You're out different, it sounds even too. And that's the sign of a more healthy joint that sounds like that. And that too. And one more on top. Good. And then on the outside there. Okay. Good. And let's have you take a few steps so we're all through. I want you to feel the difference as you walk around and move a little bit and see maybe how different that feels. What do you notice as you walk?
I don't feel anything in my knee, which is weird.
In a good way. How
I feel
long?
kind of like light, like floaty.
Good. How long has it been like that?
Oh my gosh.
That you had been feeling it
Let's
before?
see.
And we have a list. We literally have a list. I'm gonna
Yeah.
peek at this list.
I want to say like 10 years.
So 2007 was the left
Longer,
knee
13
dislocation
years.
and the ACL. Yeah. So it's been
I'm
years.
trying to do a squat.
Yeah. And does that feel
I
different? as you
feel
go on?
like, yes, I feel like so much stronger. And actually, my glutes are like,
They're
I know I work out. I know I'm strong. But they're like,
They're online.
they're useful, yes.
That's, yeah, because if we're using them and they're not working.
I don't feel that in my hips either
Yeah.
when I squat.
Let someone do the work.
And
But,
why haven't you came in?
you know, I've been seeing you guys all over Instagram, and I've been wanting to come in, and I just haven't had the time.
Wow.
I'm happy it worked out this way.
Okay, cool. All right, so we did some stem, we did some traction, some other things. Did they help at all, or was it just?
Yeah, definitely. Like I came in very stiff. I
Okay.
feel like it kind of like moved me up a little.
Okay, cool. So let's do a quick exam. We'll check you out. How about this way?
No,
How about this way?
a little.
A little bit. On the right or left?
Discomfort.
Right or left?
Like right here.
Right there. All right, right there. Let's have you lean forward for me. Any pain?
No. No pain.
About to bring to the side.
No.
And this way.
No.
All right, stick one leg out for me. Any pain?
No.
Switch. Any pain?
No.
And cough for me. Any pain?
No.
No? All right. Let me let that
This
table
way?
down. Yeah. Anything we need to know about, Anna?
Not that I'm aware of.
All right, cool. Slide down for me just a little bit.
I don't know if I can do one finger, but I would say like just like
In this area.
between. Yeah.
Does this hurt when I
Oh
press?
no, but it feels good.
About right here.
Kind of. I would say like right under like the wingtip.
Right here?
Yeah.
Like in the lap?
Yeah.
Okay.
Definitely the lat area is a big one.
All right, cool.
And then here it's just like really like
In the trap?
I pull those muscles a lot.
Do you,
Like
do you
really.
exercise a lot?
Yeah, exercise, and I'm always really active.
Jesus. There we go. All right. So I want you to let me know if it's too much. That's good. All right, now we're gonna go into something called some grasping. Is that okay?
Like that. Yeah.
How we doing?
Good.
Good. This lat?
Yes, that one definitely. It's more painful.
That's good. All right. So we're gonna have this table move up and down. This is called flexion distraction, okay?
Okay.
Let me get this mic. Matter of fact, we'll leave it there. We'll leave it.
Okay.
Let your arms drop for me. Slide up for me just a little bit.
There. And drop.
Your arms drop. I'm gonna lift this table up and we'll let it drop 3 times, okay?
Okay.
Let me have you lay on your side.
Like
So,
this? Like this.
bend this leg. Just relax.
Oh my god. Oh, that felt amazing. Same thing, like that?
Yeah. Let me have you bring this forward for me just a little bit. No, no, straight. Bring this right here. Bring this right here.
Oh, my hips,
There
sorry.
you go. Bend. Good. Hug yourself. Just relax. No, that's not that much. Just relax.
Jeez. Clearly been a while.
All right, let's have you lay on your back.
Oh my God.
What we doing?
Great. Oh my goodness. I didn't even think my neck could crack like that.
How we doing?
Great. Definitely great. I've always been so scared to get my neck cracked.
So you never been adjusted before?
I've been adjusted, but I've been like, it terrifies me. So this is the first time I've actually been like comfortable enough to like let someone do the work.
What? Just relax. How we doing?
Good.
Sit on up. Swing your feet around.
This way?
Mm-hmm. Just relax. Good. Stand on up. How you feel?
Great.
Walk around, test it out.
Feels so good. My neck feels amazing. I don't think I felt relief in years in my neck.
Wow. And been waiting all this time.
Oh my goodness. Keep that core tight. Ooh. It's making me feel sensational. Dropping weight here, losing calories. Honestly, I don't need to do any more cardio. This is cardio enough. Yeah. This one here, I would say I feel it more in the glutes. So high, I felt it more in my quads. That was more so a full body or a full leg type of. This one is medium. So I feel this more in my glutes. It's giving my quads a break. And then let me go to low. Oh yeah, that shit is just. I don't really feel this one. This one's kind of like just waking me up, shaking me. Yeah, wobble, 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 wobble. Yeah. Back to high. So can I squat with this? Oh yeah? My quads are going crazy. My calves are shaking. Wow. No, not like that. Just one of these squats. Oh, wow. So if ever your calves feel super tight, you know. Oh, what? Yeah. Let me see, maybe like.
All right, guys. Today we have Karen.
Hi, everyone. How are you? Oh. I'm sorry.
It's all good. Karen's waving at everyone. So Karen, what's going on?
So I am feeling tension. I've been having a lot of tightness, I would say, in my muscles, in my shoulder.
Mm-hmm.
When I was doing the muscle, I believe the electrotherapy, I felt a lot of nerves being activated or awakened with the electrodes attached to me. Mm-hmm. So I do know my rear delts are feeling more so, they're feeling tight.
Are they activated or are they inactivated?
They're activated right now for sure. But while I do work out, I do feel.
You have rear delt problem?
I do have rear delt problems for sure. Yeah.
Okay.
My neck and my lower back, I do lift very heavily. I am a bodybuilder. I've also had kids, so my hips as well, and knees.
Knees?
Yes.
So
knees.
everything.
Basically everything. Yeah, everything.
I'm a bodybuilder.
You're a bodybuilder?
No.
Yeah, you be. Oh.
Everywhere, right?
It's everywhere. I wouldn't say necessarily pain, but definitely
Where's it tight?
discomfort.
Where's it mainly tight?
Definitely the back. That needs to get, you know.
So put your finger where the back is tight.
Lower back, but let's probably start with my shoulders.
Start with the shoulders.
My rear delts. This
Alright.
area, I do feel like it wants to get
Okay, so we're gonna start with some grafting.
right.
We're gonna do some scraping on these rear delts, okay?
That goes a long way. It's gonna last you forever.
Trap seem pretty tight too. You got a lot of tattoos, man. It's a butterfly?
This is a butterfly attached to an elephant, attached to some more crap.
Okay.
Yeah.
Butterfly, elephant, I see how that goes together.
Right. The ear of the elephant
Is the butterfly bigger than the elephant?
in real life.
Don't worry about it. Do not worry about it at all. Come on. You're not in love with this shirt, are you?
Actually I am.
Oh,
I just
man.
got it. Oh. Coach by Rocky.
All right, let's move those arms around. Let's see how you feel. Any better?
Outside too.
Outside? Dang. All right.
Okay.
You a gangster and a bodybuilder. All right. And have you been adjusted before?
I've been adjusted before, I want to say about 7 or so months ago in Chicago.
In Chicago?
Nothing like this.
Nothing like this?
No shade.
No shade.
Nothing like this.
All right, just relax for me. Any shoulder? You said shoulder issues, right?
Yeah.
So we're gonna adjust your shoulder first, okay?
Okay.
Just relax. Let me see this arm. Just put your hand right there. There we go. Good. Bring it down. Just relax on me.
Oh, god dang. Used to do this as a kid too. I'm going to anticipate it.
Just relax. I got you. There we go.
We used to do this to our hands and our toes, fingers and toes.
Good. Sometimes people go to let their cousin do it and all kind of stuff. They're gonna have some problems. Let your head drop into my hand. Let it drop. Let it drop.
Golly! Almost saw God. That felt great. I'm not gonna lie. Wow. You want to do the other side?
Yeah, I got you.
Oh my God. Okay.
What's normal?
Oh my goodness.
Let your head drop into my hand. Let it drop. Let it drop. Let it drop.
Mm-hmm. My neck is renewed. You know,
I don't know what it means. I don't know what it means.
my neck is renewed, y'all. Dang, that felt great.
Good. All right, have you lay on your back.
Okay,
On your back.
right.
There you go. You getting it.
Dang.
Have you been this leg? Hug yourself. Straighten this leg out. Straight, straight. There you go. Just relax.
Oh my goodness. Oh.
Okay. Hug yourself. There we go.
What does this do? Does this straighten the back?
So what we're doing is we're mobilizing the joints.
Yeah.
In the spine. This ain't. We're doing now, we're mobilizing the joints in the spine.
Okay.
To relieve any pressure on the nerve.
Yeah.
Snapping the joints and stuff like that.
I do feel it relieving pressure on my lower spine.
There we go. Good.
Oh my goodness. My erectors? And that's right in the middle?
The erectors are like right here.
Okay.
all of this area. So right now I'm gonna do. Let me have you lift this leg up for me.
Which leg? This one?
Yep. I want you to lift it up without bending the knee.
Oh, without bending me. My bad. I'm about to kick you in the face.
All right, relax. This one. Right back down. This one. All right, good. That's what I'm gonna do. I have this table drop 3 times like that. Okay.
Okay.
Just relax. 1, 2.
Sorry.
You could, yeah, just relax.
Oh, wow. That was definitely my ankles, too. Oh, yep.
Right. I got you.
Mm-hmm.
Let me sit on up.
Thank you.
How do you feel?
I feel great. I definitely still feel like my lower back, my back itself is an issue. So as you said, it's tight. I know it's tight. So yes, I'll start foam rolling. But other than that, you cracked me. You definitely got my neck. You got my ankles, my shoulders. Shout out to the electrotherapy. I think I need to come back and do more of those
I
for
got you.
sure.
Let's have you stand up, walk around, see how you feel.
Oh, just walk around? Okay. Okay, walk around for real.
How does it feel?
No, I feel good. I feel really good.
Dancing move, right?
Don't please. No, I feel great.
There you go.
I'm like, I'm okay. I was like,
Okay.
yeah.
Yeah, let me check out the back a little bit here. Any pain down here? You said you feel it kind of in between the shoulder blades here?
Yeah.
Definitely be able to get some movement through there.
I've been in physical therapy because I managed to mess up my shoulder while working. And she's like, yeah, your posture kind of sucks.
So we're here to work on, right?
Yeah, she says I hunch, like I move everything forward.
Yours isn't bad though. I mean, yours is very minimal, so you're actually doing pretty good.
Perfect.
All right, so yeah, I'm gonna take you through a full body adjustment. I'm gonna work neck, mid-back, we'll kind of work full spine. We're gonna start with the neck first here. This is the magic hug if you've seen this one. Did you watch the videos at all? Kind of get a heads up?
I would say I did not. It's going to be a surprise.
Okay, cool. We'll get some authentic reactions. So we're gonna start right here. There's gonna be C1, C2. Just nice and relaxed, a little pressure here. Good release there. Let's see how this right side feels. Same thing, just let this fall. Nice and relaxed for me. A little tighter on this side.
It's so satisfying to hear.
That was a good release. Very good. Press your elbow back into me. There we go. Press back here. Good. Those are nice little baby pops there.
Yeah, I was like, that was so much easier than I thought it was about to be.
It's like concrete through here. A little pressure. Good. Let's do a couple more here. Good. One more. Good. Yeah. That's pretty tight. Some good movement through there though. The elbows together for me in front. Nice and tight. Little pressure. There we go. I know. That was a really good one. Let's see how this is. Okay. A little tight here. Pressure. That was a crispy one. Good. That one was better than the other side. That was really good. The decompression, you're going to feel this go down the back.
Okay.
You're going to feel the vertebra open up and decompress.
Okay.
And just stay nice and relaxed for me. Okay. We're going to take a breath in and out.
Oh my goodness.
There we go. So that's most people's favorite.
Yeah.
Adjustments. How far down the back did you feel it?
I was saying, I felt it like down to here.
Perfect. That's what we're looking for.
How awesome.
Yeah.
I feel like I'm going to be so relaxed today. It's
You're gonna be a little bit taller too.
Yeah, absolutely.
All right. Yeah, maybe right here. Good.
Oh my goodness.
These are really good. Nice. Not getting that one. There we go. That's a cool ring.
Thank you.
Nice. Pretty good.
All the crunches. My mom was like, are they sure they want to hear all that?
What do you, as a chiropractor, that's like what we love, right?
You're like, this is the most satisfying thing ever.
The crunchies are fun.
Yeah, no, my mom if she hears anything pop, she starts gagging. So
Okay.
she was like, they want to hear that? I was
It's like,
"Yeah,
we'll have
probably."
patients that come in that love to get adjusted, and
Yeah.
then the spouse will be like, they hate the cracks.
Yeah.
Or we've had people that are like, I have to leave the room.
Yeah.
Either they can't even sit in here. So.
Yeah, no, she's that way. Where even if I like pop my fingers in the room, she's like, I have to go. I'm like, well, she had to get adjusted before. She's a nurse as well. And they cracked her neck, and she's like, that's it, I'm paralyzed. You can still move, Mom.
She was stressing.
Yeah, she was terrified.
How do you feel?
A lot better.
Good?
A lot more
Yeah,
calm.
that was perfect. Great adjustment. Everything felt good. Super crunchy.
Awesome. Thank you so much.
Yeah, of course. What type of things give you trouble?
Nothing really.
Everything feels okay?
Yeah, I feel like, I don't
If
know.
you had to pick something, you
I
feel perfect all the
I feel like
time.
my knee a little bit, like when I walk, kind of. Maybe the back too.
And then you got mad at me earlier because I called you a bartender.
Yeah.
But you're not a bartender.
Mm-mm.
Okay.
Cocktail waitress.
Tell me a little bit about what your day-to-day is like.
I see a lot of people.
Mhm.
I talk to a lot of people, so it can be a lot and overwhelming. But
Mhm.
when at the end of the day, like it's all worth it. you know?
Yeah. It's a very rewarding job.
Yes, it is,
Okay.
yeah.
It took like a solid 2 months to get you to come in for the appointment, though, I think.
I know.
We've been working, this has been a work in progress for a while.
I canceled. It's because I'm scared.
You canceled?
Yes. Remember I called. I think I told you I was sick.
So
Do you remember that?
She's admitting she lied to me.
I told you I messaged you and I said I'm not gonna lie.
Mm-hmm. You can go ahead.
Sorry.
Yeah. What were you
I got
saying?
scared.
I'm not doing anything yet.
I was like, I'm not gonna lie, I'm scared, and I think I kind of hinted that I lied.
Yeah, so you're so nervous about the first appointment, you're like, I can't come in.
Yeah.
But now,
And then,
we're here now at least.
yes, and then, yeah.
I think today's the day, yeah. All right. So we're gonna start with the neck here.
Okay.
Start on this side. She's really scared of the cracks, so we'll see how it goes. Just drop this head down for me. Good. Nice and relaxed.
Oh my god.
Okay.
Do I move back? Like, is it okay to move?
You can move. It's okay.
Ooh, wow.
How we doing?
Do you ever think your job's like wild?
All right.
It's very surreal.
You did way better with that than I thought you were gonna do.
Yeah, I mean, I thought I was gonna pass out.
That'd be viral content for sure.
You're like, you can do that if you want.
Yeah. Same thing here. All right.
I see like some spots after.
Feeling a little lightheaded?
No, I think I'm fine.
All right, let's hands on your hips for me.
Like that?
Yeah, a little bit harder. There we go.
It's a little one.
There's a little baby pop. Same thing here, press back. A little bit harder. All right, we got to get you to hit the gym. Let's go on your stomach for me.
Call me fat.
Whoa, no. No.
I'm kidding.
I was saying you weren't strong enough. Don't twist my words. Let's go on your stomach for me. Just like that.
Oh my god.
Nice.
Wow.
She's gonna become a crack addict for sure.
Oh.
Nice. Really good one there. So low back here, you can just stay nice and relaxed.
Oh.
There we go. to the other side. How are we doing so far?
Yeah, it doesn't feel like how I thought it would.
Yeah, you thought it was gonna hurt
Yeah.
or be uncomfortable?
Yeah.
I think she likes it. And get this side here.
Ooh.
Even bigger on that side.
We're getting through it.
You're making it. Did you see the towel decompression? You see that one?
I don't know.
Okay. So you've done great with everything else, so I think you're gonna do good with it.
Okay.
So lift your head up for me and back down. Good. All right.
This one was the scariest one, I think.
You got it. You got this. All right. So for this one, just stay nice and relaxed.
Okay.
Take a breath in. Let it out.
Oh. Oh my gosh.
What do you think?
Yeah. Feels nice.
You did it.
Yeah, I did. Is that it?
For that part, yeah.
Okay.
We're gonna keep going. I'm just giving you a second.
Okay. Yeah.
Usually people need a minute after
Yeah.
that to just breathe through it, you know?
Yeah. Okay.
Feeling okay?
Yeah. That one I think felt the weirdest.
How far down did you feel that?
I want to say like right here.
Okay. All right, we're gonna check the neck one more time.
Ooh.
A little bit more.
Wow.
And just stay relaxed. There we go. You feel those?
Yes, I did.
I can't get a good read on you right now. You can go ahead and sit up.
Can you read all your patients?
What's that?
Can you read all your patients?
I feel like I usually have a pretty good read on if they liked it or not, yeah.
I'm like kind of shocked.
Yeah. How do you feel? How was
Good.
everything?
Yeah, it was really good.
Not as bad as what you expected, right? Okay.
Definitely not.
Did you have one that was your favorite or stuck out to you?
I didn't think that I would like the head pull, like the spine one, but I think that was my favorite.
That was your favorite? Okay. Tell me all about it. What's giving you trouble?
Like I've said before, I always have neck pain, always have lower back pain and hip pain. Here recently, like I've had a lot of knee problems, and that's just from like me bartending and standing all day and running around. But yeah.
And where were you deployed to?
I was deployed in Texas, down at the border, doing the border mission.
Gotcha. So lots of back pain from, you said you were carrying some heavy equipment?
Yeah, we had real heavy vests on. We had those big old heavy helmets. Sat in Border Patrol vehicles all day, so that's not really the best thing to be sitting in all day because you're slouched over. You're just trying to be comfortable all day, and then you get up and you walk around, and the ground's real hard, so that's not very good for standing on all day.
Yeah. You get hot?
I think I sweat out majority of my body weight almost every day.
Yeah.
And that was probably the most water I've ever drank in my life. I'm terrible about drinking water.
Good adjustment today, right?
Yep.
All right. Sounds good. Well, yeah, let's go ahead and get started.
Okay.
Go ahead and scoot forward just a little bit for me. You're actually in a perfect spot. You sat right in the exactly where you should, so.
Just like that's fine.
Right? Back at it. So it's long overdue. You think you'll be pretty crunchy today, or
I think
what's your
so.
prediction?
Well, I was sleeping on my boyfriend's dorm twin-size bed, so I should be pretty crunchy.
No, thank you. That sounds horrible.
Oh, it's awful. Oh.
Yeah, dorm life can be rough. All right, let's try this side. That left side did feel pretty tight. Just drop your head down. Nice and relaxed. Nice. All right.
That was nice.
Hands behind your head for me. Interlace your fingers. Great. And then we're going to bring your elbows together.
Oh my God. See, I remember that one wasn't as big last time.
That's
Now
probably
it
the
is.
biggest seated thoracic I've ever gotten.
Oh.
That was massive. Good. Press your elbow back. Easy. Very nice. Press back here. A little bit more. Okay, let's try one more thing. Just relax this arm for me. We're gonna chicken wing it here.
I do have double jointed shoulders, so.
So shoulders are really tricky sometimes.
Yeah.
They don't always cooperate. So we got one now. I'm happy.
Last time both of them did it. But
Really?
I don't know.
We'll try to come back to it at the end. We'll let the shoulder think
Loosen
about
up
it a
a
little
little
bit. Yeah. Oh, wow, she had more in there. I didn't even. Wow.
Like a glow stick.
No kidding. Super crunchy today. Okay, I think we finally got everything
Oh, that was nice.
out of the mid back. Sorry. This is the one you like the most?
Yes, it feels so good.
This one's my favorite too.
Yeah.
It's like, I don't even know.
Everybody, I don't know. This one
It's
just
like-
hits different sometimes.
Sometimes I try to like do that in my bed, but
Yeah,
I'm by
like
myself.
that.
Keep
You
the leg
just-
over.
Yeah.
Nice and relaxed. Wow. I mean, you just have one of the loudest adjustments I've ever seen.
And see, like when I'm sitting in a chair and I just try to like pop my back like I normally do, here recently I haven't been able to do that. I've just been really stiff.
Well,
I've always wanted to do this one too.
there you go.
I'm like, I'll probably get a loud crack out of this one.
So, yeah, we're building up to it. Lift your head up for me. And back down. So, yeah, you just stay relaxed for me.
All right.
Breath in. Let it out.
Oh my God. I feel like I'm 2 inches taller.
How far down did you feel it?
I felt it all the way in my tailbone.
Sick.
That felt so good.
She's going to be a noodle.
I am. I'm gonna be so relaxed for this.
She's going to be a craft noodle. These are kind of like fitting socks now that I think about it.
Exactly.
Good. Okay. All done. How you doing?
Feels so good. I am so ready now for the 17-hour car ride.
Yeah.
I feel like I can go party for a week straight now.
Here's
My spine.
Yeah.
I have recently been x-rayed and it showed a curvature of the spine, which I wasn't expecting. I've also got supposedly arthritis in my neck, possibly in other places as well. I do a lot of lifting. I work in a warehouse. I'm on a concrete floor all day. So yeah, I want to see a chiropractor and maybe get some of these aches and pains worked out.
Have you ever seen a chiropractor in the past?
Yeah. As a matter of fact, I went to one in Webster Groves a year ago. You know, that guy, he had this table that he would put me on. It was electric. I'd stay, like, and then he'd press a button and it would lean back. And then he would do something, I never saw what, but the table would go chunk, chunk, chunk. He never gave me what I would call a proper adjustment. He was never hands-on. I mean, I went to him 7 or 8 times and that was it. I'd had it with him.
Right, because you weren't getting a manual adjustment. You didn't feel like you were getting anything out of the
I
treatment.
wasn't getting anything out of it. So here I am to see what the heck happens.
Yeah. So you said you saw some of the videos online. What did you see in the videos?
Well, like I said, I guess you call it the decompression.
Yeah, that's my
And,
name for it.
And you standing on the table grabbing people's necks. And I mean, I'm like, yeah, let's, I gotta go see this guy.
You want somebody to rough you up a little bit?
Oh yeah. And it's gonna be right here. Standing in the corner. With the camera in hand.
All right. Well, let me check out the back a little bit and we'll get rolling.
No tenderness.
Now, you said you work in a warehouse and you lift heavy boxes, heavy containers.
The heaviest box I lift regularly is something like 54.6 pounds. However,
Exactly 54.6 pounds.
I know because I just weighed it yesterday.
So I'm noticing that lateral flexion in the neck here is pretty restricted. So we want to be able to get that ear over to the shoulder a little bit further. And then when we're going through the mid-back there, feeling quite a bit of restriction and stiffness through there. So those are going to be the areas that I think could use the most attention. Who is that?
Oh, you don't know who Dr. You don't know who who Torquemada is?
Is that a chiropractor on YouTube or something?
No. I strongly suggest you watch Mel Brooks's History of the World Part 1.
Okay.
Torquemada was the head Spanish inquisitor.
Oh no, I feel like this is going somewhere
Yeah,
bad.
historically, he gets compared. Hitler gets compared to him, and he gets compared to Hitler.
All right. Okay.
Hurt me, Doc. If your chiropractor isn't hurting you, he's not doing you any good. Come see this guy. Agony guaranteed.
Oh man. All right.
I keep all my coworkers in stitches,
Entertained?
in stitches all day long. Don't ask me how.
I'm sure you do. All right. So let's go.
Okay.
We're gonna lean this head over here. Pretty restricted here. We're gonna go right here.
Oh yeah.
Never had anything like that before?
Nope. That's one move I've never experienced before.
What about the decompression?
Never experienced that before. Looking forward to it.
I love it.
Dr. Torquemada. You can't talk him out of anything.
Oh man, well, my job's really fun. All right, we're gonna drop this down here.
Oh yeah.
Ooh. Are we in pain yet? Not yet. We're just warming up.
Oh well, yeah.
Let's go. Hands on your hips for me.
Hands.
Just like that. Press this elbow back into me.
Oh.
Same thing here. Press back.
Oh.
One more time.
Oh yeah. Fourth, I'll be 58 years old.
Wow. All right. So mid back here.
Uh-huh.
Nice and relaxed.
Oh yeah.
There we go. Another one here.
Oh.
One more here.
Oh.
Wow. Did you feel that one too?
Oh. Doc, what you doing back there?
Face me on your side over here. Just like that.
You got it.
So low back here. There it is.
Okay. Other side?
Other side.
You think I'd remember this?
Same thing here.
Oh.
Nice. And we're gonna go flat on your back for him.
Here we are.
What do you think this is gonna feel like, Charles?
Wonderful!
Yeah?
I want to feel it all the way down my spine, just like everybody else says they do.
Uh-huh.
Yep.
So we gotta get a good one. The pressure's on right now.
Yeah, so let me ask you something.
Uh-huh.
I saw the x-rays of my spine a few weeks ago, and there was a definite curvature. Will doing this compression do anything to take out that curvature?
No.
Even just a little, no?
Old school chiropractic might say yes. Research in the last 20 years has shown we're not moving bones, but we're improving mobility in the joints. So as we loosen up the joints, as we loosen up the muscles, you may notice changes in your posture, absolutely. But as far as adjustment equals change in spinal curve, that's not exactly right. But you may notice you feel a lot better and you move a lot better is a more accurate way of describing it.
That's the important thing, really.
So with the decompression, just stay nice and relaxed for me. I don't need you to do anything. You're going to feel this down the back. You'll feel all the vertebrae open up.
Oh, yeah.
Separate here. And we are ready to go. So breath in for me. Let it out.
Oh, yeah! That was magnificent. All the way down. Oh. I want to try something. Do I need to stay tied in here?
Oh, yeah. We can get you up.
I mean, do you need to leave me tied in before I do anything?
No.
No? Okay. I want to try something here.
Uh-huh.
You get
Go
it?
for it.
I'm just wondering. I didn't try this before. Holy Moses. How far do you think I am from my toes? 4 or 5 inches?
Yeah, I'd say 4 or 5 inches.
I guarantee you, if I would have done that before you did all this, I wouldn't have gotten any further than that. Probably 8 to 10 inches.
So big improvement for what you're used to.
Oh yeah. I do feel a little of that residual pain up and down my spine, but I had an ache to the right of the spinal column near the right shoulder blade. That is completely gone.
Awesome.
I feel absolutely magnificent. Is there anything else you can do to me, Doc?
Yeah, there is. Lay on your back for me.
On my back. Oh, yeah.
A little pull here.
Oh.
Good. Same thing here.
Oh.
There it is.
Yeah.
Now you can sit up.
Now I can sit up.
All right.
Am I good?
You're all good.
We're done?
Anything else you want to say to the camera? This is your time, so.
Thank you, Doc.
You're
He's
welcome.
the man.
Tell me a little bit about the back pain. What's going on?
Okay, so I used to be a kickboxer or whatever. I stopped for a little bit and I stopped that completely, and like therapy helped for a bit, but it just came back ever since I started doing truckloads at work, and I'm just trying to get my back.
Truckloads
Yeah.
as in like, are you unloading trucks? or?
Unloading and then like stocking stuff on shelves from the crates. It's usually towards the bottom, but it's now hitting more like up my spine.
Okay, so feeling it from the lumbars up to maybe like T10 here, a little bit above the TL junction. Never seen a chiropractor before either, first time.
No.
Okay. Any numbness and tingling in your legs, anything like that?
A bit of fatigue in the legs, but usually nothing in the legs.
I've noticed that's bringing your head forward just a little bit here. So, but it sounds like you're up and moving most of the day. You're not sitting a lot throughout the day. So, okay. Any tenderness in here?
A little bit.
Okay. Are you in school?
Yeah, online though, because I'm working 8 hours a day usually.
So we're just feeling for restriction wherever things are tight. And you've got quite a bit of restriction. So you've got a little bit of a curve to your spine. It has a convexity to the left, meaning that when you come down your back, it shifts to the left a little bit here. And it kind of curves back to the right. Sometimes when the joints get restricted, they can become painful because you're not able to fully move through those segments. So what I want to do is go in there and start to release those joints again, get that mobility going in your spine, especially in that area where you're having a lot of pain, so that mid-back to lower back segment. So we're going to try to open that up and do that through adjustments, right? So when I adjust the spine, it'll start to loosen those segments back up. I just want you to stay nice and relaxed for me. I'm just going to drop the head over, just drop the shoulder down. Do a little pressure here. Wow. How'd that feel?
Very good. That was loud.
Yeah, yeah, it was. Stay nice and relaxed for me here, okay? I'm just gonna let this fall. A little pressure. Wow. Crunching. All right, it's a great start there. So for this one, you're gonna feel this go down the back. You're gonna feel those vertebrae open up and decompress. Just stay nice and relaxed for me, okay? So just nice and relaxed here. Keep your teeth together for me. Breath in, let it out. There we go. How'd that one feel?
It's like hitting into my head now.
How far down the back did you feel it?
Like right here.
So for this one, you're gonna actually lean back on my knee here, and then I'm gonna have you do hands behind your head for me. Good. Okay, we're gonna lift up a little bit, take a breath in, and let it out. Wow. Okay. And you feel that kind of through this area? Did you really know what to expect?
No, honestly, I didn't think it was going to be that crunchy.
Really?
No.
You thought it might be like one little pop or
Yeah.
something? There's one. Excellent. There's one release. A little more pressure here. Just take a breath in, let it out. Oh my gosh. Crunching. Wow. This is the loudest one of the day. Okay, we're going to work the left side here. Nice. Now I'm going to work your hips. Hips play a big role on how your lower back feels and how restricted things can get, so we want to make sure we mobilize these. Great. Okay, press this elbow back. There we go. That's what we were looking for. Next, I want you to stand up for me. Reach down towards your toes. Okay. How does that feel to you?
Better.
Better?
Yeah.
Better than before?
I mean, it feels a lot looser than it did.
Yeah, able to reach down further. Which one was your favorite?
The neck ones are so I think the back, like the twisting one.
That one you felt the most relief with?
Yeah.
Wonderful.
Not like regular ones.
Yeah.
Like mainly like after a night out.
You ready?
Yeah.
You think you're gonna be pretty crunchy?
I don't know.
Who'd you bring
I think
for?
I'm gonna crunch. I haven't gotten it done in a while.
This is your emotional support
Yeah.
friend, right?
That's her.
I got you, girl.
We were wrestling.
All right, here we go. Nice and relaxed for me. And do a little pressure here, okay? There we go.
That actually was nice.
Yeah. Good one.
Nice.
Pretty crunchy there.
Yeah, I am pretty crunchy up.
Just relax this arm. There we go. You hear that?
Yeah.
Let's go. Hands on your hips for me. Push back. There it is. So we're gonna lean back here. I'm gonna have you do hands behind your head for me. Okay, take a breath in. Come up a little bit. Breath in. Let it out. That might be the loudest one I've ever done on that. No lie. That was crazy.
That was good.
That was nice.
Winner. I recommend that.
That was your favorite?
Yeah.
Nice.
That was good.
That one was okay for her. I don't think she loved that one, but
Yeah, no, I like that.
flip to this side for me. There we go.
That was cracked.
Cracked? All right.
Cracked.
That's a good answer. This is the one you were talking about, right? Did you not do your research before you came in here? You didn't look at the videos?
No, I. Well,
videos on the way here.
You're like, this is what he's about to do to you.
I'm like, oh no.
We were doing?
I don't know. I thought we were just getting adjusted.
Yeah.
And like,
We're just offering free adjustments. That's funny. Next one is called the decompression. This one you'll feel go down your back, so you feel it all the way down your spine. You feel this down into your lower back. So just stay nice and relaxed for me here. I'm gonna have you take a breath in and let it out.
oh my god.
How do you feel?
It feels like my head came off of my neck and went back on.
It's still on there.
Yeah, it's still on there. I felt it like in my spine, like mainly like lower.
With your relationship, like everything's a secret. There's some inside stories here for sure.
No,
Nice one.
that was good.
Sir.
Yeah, I would say like the lower back and like the neck area and like right here are my main problems. But I'm in a desk all day, kind of like hunched over, so
Yeah, gotcha.
that'll do it.
What'd you say you do for work?
Recruiting and roofing,
So sitting, how many hours a day do you think?
probably 8+, depending
8+
on the day.
hours a day?
Yeah,
Okay. So lower back, neck, all from sitting, or you think there's other things that contribute maybe?
maybe the gym,
Okay.
not the right form sometimes.
Okay. All right. How often do you work out?
I work out like 3-4 times a week.
Okay.
Yeah.
Guys are pretty active too.
Yeah.
You get any like numbness and tingling in your legs or arms? Nothing like that. Go this side. And that side's a little bit more limited. Look up at the ceiling for me. Okay. Lean your ear over to your shoulder here. Let's go this direction. How do all those feel for you?
I felt that one felt more tense on this side.
And then face that wall and reach down towards your toes. Okay. Got some limitation in the lumbar here. Stand back up for me. Can you bend backwards? See how far you can go into extension?
Pretty
Okay, that's good. So limited in flexion, not extension. You ever get headaches?
Yeah, sometimes.
Feel them at, is it back here?
Sometimes like up here and like a little bit back here, yeah.
Okay. You said you've been adjusted a couple times?
Yeah, I'd say the last time I got adjusted was before I went to college, and I'm graduated, so
Okay.
probably a
It's
few
like
years
5+ years ago, probably. Some tightness on the right side of your neck for sure. Any pain when I press in there?
Yeah, a little bit.
A little bit. A lot of restriction through the mid back there too. Right inside the shoulder blades, right in there. Just relax your head for me, a little pressure.
Oh, that was awesome.
Wow.
That was great.
We'll probably release every joint in her neck on that.
I heard it from here. I'm like, oh wow, that was awesome.
When they adjusted you in the past, did you just have like the standard kind of like
Yeah,
twist the neck?
it wasn't anything like that.
This is definitely your tighter side. So just a little pressure.
That one was really good.
Crispy.
Oh.
Those are great. Okay. Press your elbow back into me. There we go. Nice and easy. Press back.
Ooh.
Easy. Perfect.
It's like I needed that. That was so good.
Those were ready to go. Perfect. We're gonna come through here. We're gonna lift up, nice and relaxed.
Oh, that was
There we
great.
go. Perfect. I think, yeah, pretty much every segment on the mid back there too.
Everything you've done is amazing. Love it.
Any pain so far?
No.
No pain. Everything's
at all.
feeling good. Okay. So this is low back, little pressure here.
Ooh.
Dang. So a little pressure. Nice.
That's good.
It was a little stuck on that side.
Oh yeah.
Back down. So you didn't see the decompression adjustment?
No, I don't
Okay.
think so.
All right. So we're gonna strap your feet in for this one.
Okay.
This one decompresses the whole spine.
Okay.
So you'll feel it go all the way down the back.
Perfect. Love it. Do your thing.
You got it. So just nice and relaxed for me here. I'm gonna have you take a breath in and let it out.
Oh my goodness. That's
Dang.
crazy. That just cracked my entire spine.
You feel that all the way down?
Yeah, that was crazy. That was good.
Where do you feel it the most? Like neck?
Right here.
Right through the neck?
Oh.
Wow. Didn't expect that much release to still be in there. Good. Nice. You ever pop your fingers?
All the time.
Really?
Yeah.
Did you already do it today?
No.
No?
Not that I know of.
Let's see if we can get anything.
Whew.
There's the elbow. Good. Good. Better on the right side. Okay. Now let's check the lower back again. Can you stand up for me?
Yeah.
Face this wall again. And then bend down towards your toes. Let me see that.
Oh wow.
Okay. Big time game changer there.
Yeah, for sure.
We know extension was already good to begin with, but that's crazy.
Yeah,
Big
that
difference.
was way more down than it was before.
Nice.
Yeah.
How do you feel?
I feel great. That was awesome.
A little pressure here.
No, that's so scary.
Okay.
That is so scary. I don't know what I was expecting.
Took her breath away a little bit on that.
All right, we're so fine, I think.
You guys will have something to laugh about the rest of the day.
That's scary.
Just got it in.
Oh my god, I don't know, that's so scary.
Let's do hands on your hips for me.
Oh.
Yeah, not close. That was your knee. Press back. Good. Nice. Press back. Nice. Take a breath in for me. And out.
Oh.
That was good.
What is with the sound effects? I don't know what's going on.
I don't think you have. Oh, hold on. Her back's pretty tight. Let's see if we can get a little bit here. Okay, good.
Oh.
That was the one.
Yeah, that one did it.
Much better. You ready?
I think so.
Nice and relax on this one. Just take a deep breath.
Oh my god! Ow, that's so scary. Ow.
She brought it out. It was great.
Oh my god, yeah, I felt that everywhere.
That was wild.
That was wild. Oh. Oh.
Yeah. Nice.
I can't shut the fuck up. So bad. You need muscle.
You need muscles and chain restraints.
How do you feel?
I feel amazing.
That pressure, like on my lower back, has relieved now, so it feels really good.
Good.
Yeah.
Did you have a favorite?
A favorite? I don't know. Y'all scared me.
Yeah. Well, you made it through it now.
Honestly, I feel like it was the first one.
Mhm.
What about my favorite? Huh? The Sam one.
Yeah.
The Sam one is alright.
Sam special.
I've always had a problem with like my shoulder blades. It was working for a while, for several years, but then when I got pregnant with her, about 8 months, this spot in my neck, I felt it. And just through now 11 years, it's just been getting worse.
So mainly feel it right here?
Right in here. When I
Mhm,
touch
okay.
in here, like I can feel it all through. And
Right on our CT junction.
And nobody's been able to tell me what's wrong.
Mm-hmm.
Back in September, I went to a upper cervical chiropractor where they use the machine and it would feel better for about 2 hours, but then I would get like a raging migraine.
Mm-hmm.
Yeah, the migraines, I can feel it like going up my head.
Okay.
And that's where it goes.
Is it tender here?
Yes, it's always tender there. Oh yeah, right there
And
on
then
that side.
all the way around, right? And then here too?
Yeah, and then I can feel it in my jaw. Like right now I don't. Like today's about like a 4.
In here?
Yeah.
What do you feel there?
Like pressure and tightness. Like it was
Where do you feel it at? Is it here or here?
both.
It's
And
on both
and up
sides.
here.
Okay.
Like I can still feel it up here.
So what I'm getting right now is you've got a lot of sensitivity. You've had some adjustments. The upper cervical adjustment, you know, it only focuses on C1 and C2 here. So you really haven't had this addressed in a while, it sounds like. The approach is going to be a lot different. Therefore, the results are likely to be very different as well. So we're just going to let this fall. We're going to do a little pressure right here. There we go.
Oh, okay, that wasn't bad.
Not bad?
No, not bad. Wait, my heart's pounding, but that's
You did great.
Okay, good.
Yeah, that was a great release there, so really happy with that. Let's see what the right side feels like. There it is.
Oh, okay.
Had to go a little deeper on that side. How's that feeling?
Good.
Mm-hmm.
A little surprised. Like my head's attached again?
Called an A to P adjustment
Okay.
on your thoracic spine, okay?
Okay.
I just want you to take a breath in for me, and then let it out. Good. And again. Good. Okay, let's go one more. Good.
It's stretching.
Mhm.
Feels good.
Here we go. Okay, a little bit more. Really good. Same thing, little pressure. Wow.
Oh, goodness. That went like up here.
Walk you through this one. So for the decompression, you're gonna feel this one go down the back. The reason why I said this one was good for you is because your CT junction, it's a really difficult area to adjust for any chiropractor.
Okay.
Because it's a junction. Junctions just seem to get more restricted than other segments. You've got the CT junction and you've got your TL junction towards the lower back. So for CT with decompression, it's right there at C7T1. When I do the decompression, you'll feel the vertebra separate and kind of pull apart. And again.
Oh my goodness. Whoa. That was kind of scary.
Just lay there for a second.
Okay. Definitely released.
What do you
Thank
feel on that?
I felt it all the way down and probably like up to here, maybe. It's already starting to like feel better right here.
Doing okay?
Yeah,
Felt
I don't
the-
have a headache right now. And that's amazing. I have a headache every day.
Just take your time.
It's almost like my knees feel better too. Is that possible from it?
Obviously, everything in the body is related, right?
Okay, I'm okay now.
No, take your time. This is totally expected, totally fine. You were mentioning a minute ago you felt it through the lower spine,
Mm-hmm.
and then you felt it in the mid back as well.
Yeah.
What do you feel in the neck?
It was so deep in here, I don't even know if I like felt it up here, but in the neck, it feels softer. Like my muscles don't seem to be like as tight. But it feels better up
This
here.
was a big release.
Yes.
Okay.
Yeah. Right now, like I would normally feel like this when I lay down. Like almost like curved, but right now it's like relaxing in here.
Good. You didn't think anything else could be in there, did you?
I didn't.
Nice. That's just lower there.
Okay.
Good. Mm-hmm. These are great too.
This is not even as tight as it was before either. And that one was always in pain. And it's not like when I touch it, it's softer, like the muscle.
Less intensity.
Yes, exactly. Wow.
How does that feel?
Great. Actually, like breathe better.
On this side, and I feel this part under my shoulder blade. When I go like this, I feel sharp pain as I go up.
How long you had this problem for?
A month and a half.
Month and a half. Just sit back for me, Rose. Palms up on your lap. And put your feet out for me just a little bit. There we go. All
right.
Any headaches, Rose?
Yes.
Money gotta get made, right?
Exactly.
Just relax. But if you feel better, you make more money. Just relax. Just relax. Just relax.
Oh. Oh my God. Oh my God, it moves again. What? What else you got?
That's what we got. All right, all right. Let your head drop for me just a little bit. Let it drop. There we go.
Oh my God. That's crazy. The fact that you're telling me to ease up, I couldn't even move it as you were telling me. I can move it now. It wasn't bad.
All right, Rose, let's have you come on up. All right. Let me have you. Matter of fact, we're gonna have you sit right there. I'm gonna do some. All right, we got our CBD cream. Where is it from? Let's see. Chemistry Botanicals. If I keep doing it, she might send me a check one day, right? No, she's cool peoples. Good product. Patients like it, so that's what matters.
You got me with the CBD.
That's come around here. Right there?
Yeah, that's the spot. That into my neck from that very spot. Like under the cuff.
Under the scalp.
That. A little higher. Yeah.
Right there?
Yeah, it was a little higher to the left. Ooh, right there. I'm feeling that in here for some reason. You just sent like a.
That's enough of this for now. How's it feel now? Move it around a little bit.
No, I can move it up now without the sharp pain. Yeah, it goes from that spot to like right here.
Get some sanctions. Just relax.
Oh my God. That was like instant release of whatever. What? Guys, don't be like me. Don't wait a year. That was amazing. And I know you're not even done yet. Keep going. Go, go, go. What? God. Oh, I can't really reach this arm over this way. Like right here, it's giving me a pinch. Oh my God. I've never had that done.
I ain't gonna come in the year.
That's crazy. You do fruit massages too?
get you.
What did that even do?
You good?
Yeah, just make sure.
Slide down for me just a little bit. Let your arms drop from me, Rosa. There we go. Just relax. Just relax. Does this hurt when I push over?
No, I'm just stiff.
Yeah, you are.
I'm not even trying.
Good. All right, Rosa, do me a favor. Lift this. No, stay right there. Lift one leg. Lift this leg straight up without bending it. Lift it up. No, the other way. There we go.
Okay.
And down, the other one. Down. And lift the other one up. One more time. Lift this one up. Okay. Good. Just relax. Just relax.
Oh. That's the one. That's that one. Every time.
Other side.
This one thing is the reason that I can sleep at night.
Just relax. I got you. Just relax. Just relax. Just relax.
I didn't know I could do that.
So have you lift it up again? See how you feel?
Okay. Oh, it's not sharp. I'm feeling it here.
Right in that
But it's
trap.
not going down to like my fingers.
Good. You probably need to do some more work on this trap. I'll show you some
You feel
stretches.
it, right? That's just
Yeah.
a solid rock.
It's way tight on this side than this side. Just relax. Good. Just relax.
This is the arm I work with. Just grab my elbow. That's crazy.
Do it all. Stand up.
Thank you.
No problem. No problem.
The man right here. You guys gotta come visit him at Miami.
You gotta bring all your people, man.
I be sending little references and stuff. I be sending them. Thank you though. You guys gotta come visit.
So what you're gonna do, watch me. I'm gonna take my arm, put it behind here. I'm just gonna pull it just slightly, and I want you to lean to the side, like so. You're gonna hold that 4 sets of like 15 to 30 seconds. Now the exercise you're gonna do, you're gonna take this finger, bring it back like so, like this way. You're gonna turn that way. And I want you to act as if you're shooting at me, like move this back just a little bit. There you go. Keep going. You feel that stretch? Yeah. More. Don't use your body. Just there you go. Just keep. There you go. There you go. Point. Keep pointing. Come on.
This one hurts.
And turn your head. Lean your head over. Just there we go.
Oh.
There we go. Shoot at me. There we go. Shoot. All right, good. Also, you can work on Bring your chin back like so. Yeah, there you go. Looks absolutely normal, right? Talk to the wrong person, just get your neck stronger.
Okay. Neck ups.
All right, you work at a bar, you smell like alcohol and hookah, cigars. Be like, oh no, it's my neck, it's not you. Nothing to do with you.
You want a shot?
That's,
You wanna hit my hookah
that's
hard?
it. That's it. We are ready to go. Also, we're gonna need to strengthen your posterior deltoids.
Okay.
So how you're gonna do that? You're gonna work on motion like this. So let's say we get some bands, so the motion will be like that. Bam, boom, boom. Like so if I'm here, I want you to push against my hands. There you go. All right.
Back workouts and stuff?
Correct.
Okay. All right.
All
Now I
right.
have a workout regimen to do too, guys.
Stiff neck as usual.
Stiff neck as usual. So where's the neck pain at, Jay?
Here on the
Right
top.
at the top.
At the top. Yeah.
Can you turn your head to the right for me? Can you turn your head to the right? Does that hurt?
No.
All right, let's have you turn your head to the left. Does that hurt?
No.
Any pain?
Here.
On the right
bottom.
side?
On the right, on the bottom here.
Okay. Let's have you bring your head down. How's that?
It's okay.
Just relax for me. Let your head drop. Let it drop some more. There we go. Let it drop to my hand. Let it drop. Just relax.
Okay.
Up top, right here. Let it drop for me. Just a little bit more. Let it drop.
Feels good. Amazing. Relax.
All right. Jay, let me have you. We're gonna do some shockwave on your neck too. And so shockwave. Shockwave is gonna be, it's up here or over here on this side is where I feel the tenderness.
Okay.
Nothing to tie it up? You wanna lay down?
Better.
You can lay down, that'd be better. Magnetic impulse.
Electromagnetic. Magnetic. Okay.
Right there?
Mm-hmm.
Is that where the pain is?
Mostly here.
Mostly here?
Here. É pouco.
Can't get up there unless we shave your head. How was that?
Yeah, that.
Good?
Mm-hmm.
Just relax for me.
Yeah, that.
Right there?
Oh, yeah.
So right at that base of the skull is where a lot of people have a lot of trigger points. Just relax. Just relax. Don't fight me. Come on now, Jay.
Mm-hmm.
Act like you've been here before. There we go. There we go. And just relax, just relax. She's not moving on this side. Good. Just relax. Just relax. Just relax. There we go. Just relax. Just relax. Just relax. Just relax. There we go. Just relax. Just relax. Some more. Come on. Breathe out. There we go. That was it, huh? No?
Perfect.
On your side. Relax, relax. Relax. Don't fight it. Don't fight it. There we go.
Oh. You want this?
Yeah. Hug yourself. Just relax, just relax. Just relax. On your back. All right, just relax. 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 You gonna relax? Okay. There we go. Jay does not like to relax. How's this feel? Is this okay?
Afraid the walk is coming next.
Relax. Just relax. There we go. All right, just relax on me. I got you. Good. Relax. Good. Good. All right, Jay.
On my neck, my back, my neck and my back. Just like I always feel achy and sore. It definitely like hurts.
Okay.
Sure.
So how long have you been having this pain for?
Ooh, since the summer.
Since the summer?
Mhm.
So I'm gonna lean you up a little bit.
Mhm.
Any pain?
Not right now.
Any pain?
A little bit now.
How about this way? Any pain?
Mhm.
This way? Any pain?
Yeah, it feels like just tense.
Just tense?
Mhm.
Stick one leg out for me. Any pain?
No.
Switch. Any pain?
No.
All right, I'm gonna lean you to this side. Any pain?
Yeah.
Where at?
Right here.
Do you exercise?
Oh, I exercise a lot.
Do you exercise a lot? Any pain?
Dance. Yeah.
Any pain?
Yeah.
And this way, any pain?
Yes.
You all right there, Rue?
Yeah.
Looking like she got pain. All right, so what we're gonna need to do is fix your posture. So we're gonna need to get this up, get these shoulders back like this. Have you been to a chiropractor before?
This will be my first.
First time?
Mhm.
Are you excited?
Excited.
Are you scared?
A little bit nervous.
You should be.
know?
It's all good.
I should be.
Just playing. Your traps are very tight. All right.
Oh yeah, that's pain.
Right in there.
Yeah.
Do me a favor, let your head drop into my hand for me. Let it drop into my hand. There we go. Just a little bit.
Oh wow, that felt good. Shit. Wow. I feel like I'm almost 10 years old again.
All right, then. Let's let this head drop again. Let it drop into my hand. Just relax. Just relax.
Ooh. Oh my gosh.
All right. So how's that neck feeling now?
I feel loose.
So let me have you lean to the side. How's that feel?
Much better.
Let me have you lean to the other side. How's that feel?
Better.
Good. Just relax for me.
Mm-hmm. Ooh. Ooh, shit.
So we're gonna do your shoulder again. Just relax on me. Just relax. Just relax. There we go.
Oh.
How we doing so far?
Good.
Good. Yeah.
You know what? The neck part. That was the only thing I was scared of. The neck part. Because I was like, oh, my neck gonna break.
Yeah, we don't break neck. We broke neck, we'd be out of business.
Right?
Lord knows, they try to say we do. Whoever they are, right?
They don't break necks. They save necks.
That's it.
Ooh. Ooh. Yeah.
We needed that.
Yes.
Face down, just relax. So this right here is called flexion distraction. Just relax.
Ooh.
Just relax. Just relax, just relax. I got you.
Sorry.
There we
Ooh.
go. There we go.
Ooh.
Right in here. Does this bother you right here? Let's see if we got something.
Oh.
Good. So let me have you.
Yeah. There's a lot of pain there.
So let me have you lift this right leg up and keep it straight. Okay. Let me have you lift this right leg up and keep it straight. Keep it that. There we go. That's the highest you can go. All right, good. Let's try the other side. Down. Oh yeah. Let's try this one again. Yeah. All right. Slide down for me just a little bit. So what we're gonna have, the table is gonna drop 3 times like that, okay? 1, 2. Just relax.
Ooh. I said, ooh. Wow. That felt so good.
All right, let's have you go to the other side.
Ooh. Thank goodness. Wow. Like, that felt good. Holy crap, you're a miracle worker. Whoa. I feel a difference. Like, I almost feel like I'm 10 again. Like I could be on the monkey bars.
Stand on up. How you feel?
I feel
Walk around.
taller.
Walk around.
Oh. Huh. I postured. Okay. All right. I'm ready for the gym.
There we go. Good to go.